Hey guys, it's Paul Lynch. I'm an anesthesiologist and pain management doctor from Scottsdale, Arizona. As many of you guys know, I went to New York City in the spring when COVID first hit, and then made a lot of videos throughout the summer. But as things started to look better in going into August, I kind of took a break from making videos and went back to raising my family and running our business and trying to get on with my life. That being said, things have started to change over the last couple of weeks. Honestly, over the last 40 days, the trajectory is going in the wrong direction. And I thought it was important for me to re-speak with everyone, to make a video. Several months ago, I made a video saying there's 4 types of media, right? There's like the mainstream media, which leans left, and there's more right-wing media. There's social media, which kind of leans crazy. And then there's medical media. And I get concerned that there's not enough medical voices speaking out on what's going on. And so I wanted to take a little bit of time today to explain to people what's going to happen this fall. Maybe you're hearing rumors or you saw it on TV and you're not quite what to believe. I've made several posts in the last couple of weeks kind of leading up to this saying, hey guys, pay attention, this is getting ready to get bad. And I've got comments like, we don't know who to believe. And I like those comments when they're towards me, because I think what people are saying is they do trust me and they do believe me as a physician. And I want to, in a very non-political way today, talk to you about where we were, where we're at right now, and what's going to happen over the next couple of months. So I'm going to go back to a format that I used several months ago. It's a little more labor intensive, but I woke up at like 4 a.m. today to try to prepare this for everyone, because I think it's an important message going into the fall. So I'm gonna go back to an old format where I'm gonna show all the charts and graphs as I kind of speak over them. So I'll come back and finish up at the end. Okay, so for today's video, I want to kind of do a high-level overview of where we're at right now. So I like to start with the world. This is on worldometers.info. I'm going to put the link below. Everything I talk about today, I'm going to put a link so you can follow along. We have 44 million coronavirus cases confirmed in the world today. Now, I'm going to get into this later in the Nature article, but the reality is whatever you're seeing confirmed, the number's probably about 3 times that, just because we don't have the ability to test everyone because so many people are asymptomatic. So the reality is we're well over 100 million cases at this point. There's 7 or 8 billion people in the world, and so to think about 100 million of them already have contracted coronavirus is pretty crazy. Deaths are a little bit easier to track, not completely. It looks like whatever deaths we're recording, there's 25 to 50% more. Not all those are actually from COVID, but the indirect and direct cases of COVID. That being said, actual COVID on the death certificates is around 1.2 million deaths in the world sitting here today. What about the United States? Well, actually, sorry, before we move on to the United States, let's look at cases in the world. So yesterday, Wednesday, October 28th, was the first day we hit 500,000 cases in one day in the world. So 500,000 cases recorded yesterday in the world. So let's look at the United States. There's 9 million confirmed cases. As I said before, and I'll repeat again, it's probably closer to 30 million actual cases. We're getting pretty close to 10% of our population at this point has contracted corona. The problem with that 10% number is for herd immunity based on the R naught that we understand from SARS-CoV-2. We probably need between 70 and 90% of our population to get it, to get some sort of herd immunity. So that's just not a great strategy. We are still hoping and praying for a vaccine. But right now, actual recorded cases are 9 million in the United States, and unfortunately 233,000 confirmed dead. The actual number of death is probably over 300,000, and I'm going to show you that later on an excess death chart with a CDC. But at least confirmed dead with COVID is 233,000 deaths today. I want to look at the state level. We recorded 81,000 cases yesterday. We're breaking records the last week. We hit 85,000 last Thursday. I'm making this video right now Thursday morning, but I'm expecting today potentially to break the record again. The numbers just keep going up. What I thought was really interesting over the last couple of weeks as I've been kind of watching this and preparing to make more videos and try to educate, is the amount of cases that are, or amount of states that are logging at least 1,000 cases a day is now up to 28. So I ranked all the states from top to bottom. You can see at the very top, Texas recorded 7,000 cases in a day, and Illinois 6,000 cases in a day. But if you look, even in 28th place, Mississippi had 1,000 cases in a day. So there's 28 states they're having at least 1,000 cases in a day. I'm gonna, at the end of this video, discuss the Nature article that came out, which really grabbed my attention and kind of forced me to make this video today. It talks about how COVID has spread widespread, and by the end of February, we're gonna have 45 states out of 50 that will be over 8 deaths per million. And so 45 out of 50 states, they're predicting will have to have significant restrictions and or the public kind of taking control of this with social distancing and masks. And that's really the option. Either the government has to step in and shut things down, or the people have to kind of keep each other safe. And so I'm gonna come back and hit on that again towards the end. But you can see here 28 states with at least 1,000 cases a day of COVID. Once again, if we're showing 1,000, the real number is probably 3,000. It's probably triple that. Whatever you're seeing on the case side, you can probably triple. This is what confirmed cases look like throughout the world. It doesn't matter what we've done throughout the year. The daily cases climb, climb, climb. Some of that is due to testing. I'll show you that later, but not really. We've had pretty consistent amount of testing since June at around 3 per 1,000, but you can see the cases continue to climb, climb, climb. In the United States, when I was kind of turning my brain off and, taking a break from making these videos, part of it was because you saw this big trend down from mid-July down to mid-August. I highlighted here that the low point was actually September 17th. We only had 24,598 cases in a day. I personally was feeling pretty good. We got things under control and feeling pretty positive. But what we've seen over the last literally 37 days is that number go from 24,000 to 85,000. And that's why I'm doing this video today, to get your attention, that going from 24,000 tests to 85,000 tests in 37 days is a really bad trend that portends a lot of hospitalizations, a lot of ICU beds, and a lot of deaths coming over the next 2 to 4 weeks. And I'm really trying to sound the alarm here that this is not normal. This is not based on testing. I'll show you that in a couple of slides, but testing has remained fairly constant during that period while we had over 3-time increase in tests positive. If there's any good news in this video, it's our confirmed deaths have not started to climb yet. And I would say that even throughout the year, with a couple of spikes, we've mitigated that. And I think a lot of that's been, we've made drastic moves and we've shut down and we've done everything we can. I think we are getting better as physicians at treating this disease. And there's even argument that the molecule has morphed or mutated a little bit, so it's not quite as lethal. As of right now, worldwide, we're still hitting about 7,000 deaths per day, which is up slightly from 5,000 or 6,000, but it's not exploding yet. But I don't want us to get complacent and think, well, just because deaths haven't skyrocketed, they're not going to. We haven't seen this big of a spike in cases over a 37-day period since the beginning of this. And so the math really predicts that death rates are going to follow over the next 2 to 4 weeks. This is the death curve for the United States. And once again, it looks like we've mitigated it. You can see from June, we were down to like 200 or 300 deaths a day. And then that spiked up to 1,500 again. And we got it under control again. But the math, once again, is predicting that the death rates are going to climb over the next 5 months. I wanted to just remind you guys of H1N1 and the Spanish flu of 1918. There wasn't one peak, but 3. The first peak occurred in the spring and summer of 1918. And then it was completely under control and everyone felt great going into the fall. And then there was a massive peak, and I'm just showing it here. The second peak was 5 times bigger than the first peak. And then we got that under control again. And then there was a third peak, which was 2 times bigger than the first peak. Once again, SARS-CoV-2 is totally different than H1N1. One is a coronavirus and one is influenza. And I'm not saying that we're going to have a spike that will be 5 times worse in the spring, but I'm just saying that this is the pathology of a virus is that they will spread and they'll simmer and then they'll come back. And so I've been using the analogy with a lot of my patients, chicken pox. Chicken pox, you get it when you're 5 or 6 and it goes away and you think you're good. And then when you're 75 years old, the virus comes back in the form of shingles 70 years later. And so viruses do this. They're hard to kill. They hang around, and we need to prepare ourselves for what could happen this fall. This is tests per 1,000. I just want to show it to kind of reinforce what I said a few slides ago. Since about June, we've been over 2.5 tests per 1,000. That's pretty good. We could do better, but we're testing pretty widely. Right now, we're around 3 tests per 1,000 in the United States. Now, I'm going to hit this later. We're not doing that great in Arizona. Arizona's only doing 1.5 tests per 1,000, and so we need to step up our testing game here at home. I do want to talk a little bit about Arizona. I'm going to try not to be too critical. If anyone's followed me this summer, I've never brought politics into any of my videos, and I don't intend to start now. I don't talk about Republicans and Democrats, and I don't talk about the president or the governors. I just won't do that. But I do think as a physician, I can criticize the Arizona Department of Health a little bit because I'm kind of part of it. And I think we as scientists here in Arizona have got to do a little bit better job in how we report the data. I'm going to get into that in a minute. I actually want to start with one of the things we do really well, which is this epi curve. And I'm going to put a link below the Arizona Department of Health. The epi curve is my new favorite way to look at it. This is COVID-19 cases by day. And so instead of saying how many cases were reported positive today, I like to look at how many cases were positive on this date and time. The only way to do that, though, is to go out 10 to 14 days, depending on how long it takes to process, and go back and attribute those positive cases to the day they were taken. And so this epi curve does that. Now, it's not accurate for the last 10 to 14 days. So if I'm looking at today on October 29th, it's not going to be accurate probably back till about October 15th or October 20th. But you can retrospectively look at it and get a sense of what happened. So what's really cool about this, you can look at 5,460 cases. That was our peak on June 29th. Just to remind you guys, we pretty much opened up our economy and raised all restrictions on June 1st. So about 30 days later, we peaked in cases. So cases are always going to peak 2 to 4 weeks before hospitalizations and deaths. But on the epi curve, it showed that we had 5,460 cases on June 29th. And then we made massive changes again. We shut things down here in Arizona. We actually became kind of a model for the United States. I actually saw them covering us on the news just yesterday, showing that we had an 80% reduction in cases by the moves we made in late June and early July. That made me really proud. I feel like I was part of that and pushing for some of these changes, and many of you guys were following along and talking about the changes we needed to make. We saved a lot of lives. We decreased cases quickly, and you can see that the cases fell. And so if you look at the lowest point, we went from 5,460 to 146 cases on September 7th. But the date is a little skewed. That September 7th was actually a Monday, and anyone who follows the Arizona data knows that on Mondays, they don't really report anything. So a better way to look at it is Tuesday data. That next day was 700 cases. So we went from 5,460 down to 712. It was an 87% reduction in cases in about 38 days. And we did that, I'm sorry, I did the math wrong. That's like 68 days. And we did that by widespread changes. But then we started to get complacent. And I made a video on this. Maybe I got a little complacent. I stopped making videos. Maybe you got complacent. I know my dad got complacent. Sorry, Dad, if you're watching. But he showed up at my house and wasn't wearing a mask. And, I think it just doesn't make a whole lot of sense if you're 70 years old and you have other medical conditions to interact with people who are healthcare workers, and especially to not wear a mask. And so I think a lot of us have got complacent that this virus is just going to go away, and that's not what science says. So now we've gone from 700 cases back up to 1,280 in Arizona, just over about 37 days. And so there's this rapid increase, and it's actually worse than this data shows, and I'll get into that in a second. So I just want to review again, 5,460 cases. We made lots of changes. It dropped to 712 cases, and then I think we got a little lax, and now it's back up to 1,280. We can't blame ourselves for everything. Some of this is just the nature of the virus, but there are things that we can do, and that's basically the point of my video today, is we're going to talk about what we can do. If you look at hospitalizations, it's the same curve. I've had multiple conversations with people over the last couple of weeks where I'm getting more and more concerned and I'm trying to get people's attention and they're telling me, well, deaths are down and hospitalizations are down. Well, let's look at the data from Arizona Department of Health. We had about 382 hospitalizations on July 13th. Notice that's exactly 2 weeks after the highest point on cases. And then that 382 came down to only 16 hospitalizations on September 13th. That's pretty impressive, just massive reduction. And by the way, we do report hospitalizations every day, so that's a real number. On September 13th, we had only 16 patients in the hospital for COVID-19. We've seen that go up over the last 6 weeks. And so, 39 days from September 13th to October 22nd, we went from 16 patients in the hospital to 66. And that number, I'm predicting is going to continue to climb over the next 90 days to once again, we could potentially overwhelm our hospital systems here in Arizona. We need to start to prepare ourselves for that. Okay, I just want to go back to the beginning of the summer. On May 31st, we only had 68 patients in the hospital for COVID. We made a lot of changes and opened up society, and it went up to 382 in literally just 6 weeks. And so I just want to review that the behaviors that we make and the decisions that we make really do affect real patients in hospitals and real healthcare workers and nurses on the front lines, and eventually deaths for people that you and I know. This is not some far off place. This is Arizona. This is our backyard. Decisions we make us go from 68 patients in the hospital a day for COVID to 382. And so part of my alarm cry is that we don't make these mistakes going into the fall, that we do whatever we have to do in order to save lives and protect our families. I want to dig in a little bit to the Arizona Department of Health data. I don't want to sound too critical here, but at least want my viewers to have a critical eye and understand the data. So this is the summary. When anyone goes to the website, this is generally what they pull up. And what it shows is we had 1,044 cases reported today. We were down as low as 300 or 400 cases being reported a day 6 weeks ago. And now we're back up over 1,000 pretty much every day for the last 7 days that I've been looking at it. It says right there in big bright letters, our total percent positive with 2 asterisks is 9.7%. And if you go to the Johns Hopkins website, which a lot of people use for their daily information, including multiple media outlets around the country and AZ Central and all sorts of people, they report us as 9.7% positive. But that's just not true, and it really bothers me. Our positive rate is not 9.7%. Now, you say, why do you say that, Dr. Lynch? Well, look above. We had 1,044 cases reported today, and their number of new tests reported were 7,462. If you just do the math, 1,044 divided by 7,462, that's 14%. Now, you may not think that's a really big difference, but 10% has become almost like a cutoff point for the country and for states to make decisions on reopening, on whether to return to school, on whether to open bars. They use 10% as a decision point. The actual World Health Organization says 5% should be our cutoff, but we've used 10% in a lot of the decisions we made. So if 1,000 cases were reported positive today out of 7,400, that's 14%. Anyone can do that math. Why are we reporting it as 9.7%? Well, I don't completely understand, but the reason what they've decided to do is not give the total positives on that day or the total positives for that week, which would show kind of a trend, or even the total positives for the month of October. They've decided to show the total positives all the way back to inception in March. And I think that's ridiculous from a mathematical perspective. So 9.7% is the total positive of all tests done over the last 6 months. That takes into consideration March and April, we didn't have any COVID, and takes into consideration June and July when we had a ton of COVID, and takes into consideration this week where we also have a ton of COVID, and they blended into a number 9.7. But it gets worse. If you look below, it says diagnostic test percent positive 10.2 and serology percent positive 6.5. What does that mean? What that means is the state of Arizona has chosen to report their data as PCR tests which show that the virus is active in your body, and blood tests, which shows that you have antibodies. They've combined those two into one measure. We're one of only a few states in the United States that do that, and it's also a little bit ridiculous. And so this 9.7% has two mathematical flaws. One, it's showing all tests back to inception, and two, it's showing all tests PCR plus blood test. So I did the math on it for you guys. If you pull out the blood test, look at just viruses taken, viral antigen test, PCR test today, our actual positivity is 15%. That is a really bad number, and it's a number that we need to be aware of in Arizona. We're back up to 15%. And if you see 9.7 reported, it's just false. The other issue with Arizona right now that I just want to point out is that we're only doing about 1.5 tests per 1,000 people per day. And so this is straight from the Johns Hopkins website, which is a great website. I'll put a link below. They have all sorts of ways to sort the data. And if you're not from Arizona, you can look at your state. But nationally, we're doing over 3 tests per 1,000 per day. In Arizona, we're only doing half of that. We're at 1.5. We're actually one of the worst states in the country for testing per 1,000 right now, and we need to do everything we can to step that up. I'll tell you personally, I'm looking to buy a machine for our business so that we can test our employees and our patients. I'm doing that personally, not to make money, but I think it's the right thing to do to have more access, and I think more business owners and more healthcare companies need to get access to COVID testing here in Arizona, especially going into the winter, which looks to be a very tough time for us. I do want to review a little bit on the Arizona or on the Johns Hopkins website how many states around the country are seeing a massive increase in their percent positive. I started talking about this maybe in June or July, and then I went dark for a few months on my videos. But one of the best ways to track how quickly COVID is blowing up in your community is the percent positive, meaning the amount of tests that you do that come back positive. And so the World Health Organization and the CDC say it should basically be less than 5% to show your community has it under control. Nobody's at 5% right now, so we've used 10% as maybe like, okay, we're not 5, but at least we're less than 10. And a lot of people have used that as a measure, but 5% is really the healthy number we want. So many states are blowing up right now with 20, 30% positive. This is unlike anything we've seen throughout this year, and so I want to draw your all's attention to this. This is not political. This isn't someone on TV talking. I'm telling you as a physician, I've reviewed this data in detail, and this is very, very bad what's going to happen this fall. So Alabama is at 25% positive today. Idaho is 34.8% positive. That is a terrible number. Iowa's at 26%. Kansas is at 20%. Nebraska is 22%. Nevada's at 19% positive. Mississippi's 100, but I think that was an error in their data. Montana's at 15%. Nebraska's at 22%. Nevada, I already said that one. South Dakota's 43% of the tests came back positive. Wisconsin is at 28%. Wyoming is at 32%. So I just want to review that we have so many states in middle America right now that are just blowing up, and that's going to be very bad for these communities going into the fall. Some of these states don't have the ICU capability we have. I'm here in Scottsdale, Arizona. Right down the street is the Mayo Clinic, one of the best hospitals in the country. When my stepfather got sick, I sent him to the Mayo Clinic, and they saved his life. And I've sent multiple people to the Mayo Clinic. But if you're in Wyoming, you don't have the Mayo Clinic. You're going to have to go over to another state potentially to get the kind of care that we get here. And so I'm very anxious for some of these states that are going through this right now. This has been a very long video today, but hopefully it's helpful. I do want to hit a couple other quick things. One is the concept of excess death rates. I've heard again rumblings that COVID was bad this year, but the flu is down, and it's just not true. There's a lot of weird things that circulate on social media. If you hear these kinds of things, I recommend that you dig into the data yourself, and I'm going to give you links so that you can combat that kind of stuff. This is death rates per week over the last 3 years. It's a pretty cool chart if you're a nerd, which I am. This looks at excess deaths. If there's a little red dot there, that means that there were more deaths in that week than mathematically probable from just chance. That's a big mouthful, but basically they show the amount of deaths that are predicted in the week, which are typically 50 to 60,000 deaths per week. And then they show the range of possibilities with a couple standard deviations on either side. And then they show the actual amount of deaths. So those If you look basically since April, we have recorded 30 weeks in a row that mathematically, statistically had more deaths than would have been predicted from random chance. So anyone telling you that, oh, COVID deaths are up, but flu is down and blah, 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 it's just not true. We've had one of our worst years in probably 100 years on excess deaths this year. We've recorded over 300,000 extra deaths just in the last 7 months. And of course, the reason is COVID. I'm going to put a link below from the CDC where you can kind of track these excess deaths. And what's really scary is we're expecting a massive increase in this over the next couple of months, which is what I want to finish with. So I posted this on my personal Facebook account yesterday and put a mask up and talked about the importance of wearing masks. But I want to do a deeper dive on this Nature article. This video is getting very long, so I'm not going to be able to go into all the details that I want. This is like a 26-page article, and I would really encourage you all to read it. It's hard to read. There's a lot of math and a lot of numbers and a lot of assumptions, and it's not easy to digest. But I want to just break it down for you that this fall is going to be very, very bad in the United States from a death perspective. We've lost about 220,000 people so far. And I'm talking actual deaths recorded, not just our predictions of excess deaths. About 220,000 deaths recorded so far with COVID. Over the next 4 to 5 months, that number is going to go up to 511,000. This is our best guess based on not exactly what we're doing today, but these scientists did a really, really deep dive, and they're probably the best in the world right now, IHME out of the University of Washington. They've been supported with hundreds of millions of dollars of funding to have the best scientists and epidemiologists in the world predicting what's going to happen. And by the way, I looked at their predictions in June, and they said we would have around 211,000 deaths by today, and we have 220. So they are very, very close with their predictions. And so they're saying that based on their best estimates of the behavior, and it's a really nuanced design, they predicted the behavior of states. And so they use this concept of a threshold that every time we hit about 8 deaths per million, that states can't tolerate anything above that, and they make moves. And so 8 deaths per million in Arizona, that would be about 56 deaths a day. And if you go back and look, when we were logging 50 deaths a day, we started making really strong moves. And so they went across the entire United States and said that was a pretty predictable number, 8 deaths per million. And so based on that, they predicted when we would hit 8 deaths per million in each state, and then they predicted stronger government action, and they basically predicted, with changes that they predict, that we'll have 500,000 deaths. Now, what's crazy, and I'm going to show you this, they predicted if we don't do anything different, we just keep acting the way we are right now, we could have as many as 1 million deaths by the end of February. That's a pretty scary number, and they're not just throwing that out there to scare people. They did a very deep dive on current behaviors, current explosion of COVID cases, and where it's going to lead. So I just want to show you a couple of these charts, and then I'm going to finish. So I'm going to put a link below to their website. The website's a little bit weird because the article, which has been widely circulated, talks about through the February 28th, but the website defaults to deaths by February 1st, which is actually a month early, and February is going to be one of the worst months from their model. So that's a little bit weird. I'm still kind of playing with it, but I think you can change these dates a little bit. If you kind of dig into the data, which I'm not going to completely do here, but they show a range of behaviors that could occur based on what we do. And so the primary thing, of course, that we can do is socially distance and wear a mask. And I'm going to summarize this in person now. Okay, so this has been my longest video probably to date, and I hope that it's helpful for you guys. There's a lot more that I probably want to say, but I can't. I'll try to check back in a week or so and give you guys an update. If you look at the Nature article, and I really encourage you guys to dig into that, what you'll see is that our behavior can change this outcome. This is not set in stone. Our behavior can change it. And so there's still 4 things we can do. And I always tell people, you should make decisions commensurate with your risk level. But kind of what this Nature data is saying is, no, we should just all make decisions that's going to protect society at this point. And so the 4 things that we can do is, 1, we can socially distance. I would think in terms of 90% reduction in your own personal contacts. So think in terms of the people you work with, only kind of hang out with them. So I work at Arizona Pain. I have a Scottsdale location. I would recommend My people in the Scottsdale location don't hang out with the people from the Glendale location. Hang out with people at your work. We're healthcare workers. We need to go to work and treat patients, but you don't have to go out and hang out with 50 people on the weekend that you don't work with. So try to reduce your social contacts this fall, maybe by 90% if you can. When you're in public, of course, try to socially distance, and 6 feet's not some magic number. Get as far away as you can. If you're doing a gathering for Thanksgiving, do it outside. Like, do everything you can to socially distance. And I know it's hard. We basically have like 6 months left, probably, before we have a vaccine that's going to be widely available. Number two, you hear this all the time, but wear a mask. Wear a mask everywhere you go. The data from Nature, and I wasn't able to just really dig into it, maybe I'll do a different video, but basically shows if we can get to 95%, what they're calling universal mask wearing, we'll save 129,000 lives over the next 5 months. I mean, that's significant, guys. I practiced my whole career trying to save a life here and there, one or two lives and make a difference. We can all collectively save 129,000 lives by wearing masks. You need to do it. A lot of people have commented on my feed and asking me for data on wearing masks, and I'll continue to try to show the data there, but masks do not hurt you. They don't cause infections. They don't cause any of these things you're hearing about. I wear a mask every day at work as a surgeon. I wear a mask throughout this entire pandemic. Masks are safe. Wear your mask. 3, wash your hands. And I've been saying, I said this in my last video, not just wash your hands, but stop shaking hands. I keep seeing people shaking hands. And I know we grew up being taught how to shake hands and look someone in the eye and give them a good, handshake. That's just in the COVID environment. Stop shaking hands, at least for the next 6 months. Maybe give someone an elbow or a foot 5. But wash your hands a lot and stop shaking hands. And then number 4 is testing. If you think you might be sick, get tested. Everyone asks me about how to get tested. You can sign up with multiple labs here in town, whether it's Sonoran Labs or some other ones, and just get tested if you're concerned. The more we can test, the better. I'm actually going to do my part. I'm going to buy a COVID test and get it set up in our business. So as we're hitting this COVID spike, we can test our patients and our employees whenever we want. So that's it. The big 4: socially distance, wear a mask, wash your hands, and get tested. And if you are positive, then quarantine. Guys, this is gonna be a tough fall. I'm making this video to prepare people. I want you, whether you're a business owner or just my own family, prepare yourself for a very difficult fall. This is not political. This isn't, I'm not coming to you with a message from any party. I'm coming to you as a physician to tell you to protect yourselves, protect the people around you. We can save lives together. God bless you guys. Stay safe.